hour by hour. But as governor, I also must think about the economic challenges I know will be waiting for Kansas once we get to the other side of this public health emergency. And that's what I want to talk about today. Kansas jobs and small businesses and how we can support them, save them, and create them when the danger of COVID-19 is behind us. First and foremost, this morning I signed Senate Bill 173, the bipartisan bill establishing a new 10-year transportation plan. This plan is something my administration has been working on since I took office just over a year ago. Developed in consultation with local communities and nearly 2,000 stakeholders, it offers a visionary approach to Kansas infrastructure so that our state has the flexibility to address immediate needs and secure more opportunities for the future. Investing in Kansas's infrastructure means putting people to work. It means fixing our roads and bridges. It means safer transportation for our most precious cargo, our children. Key elements of the program include promises kept. All remaining T-Works projects will be let for construction by July 1st, 2023. Highway preservation is prioritized. The legislation requires KDOT, the Department of Transportation, to establish metrics making sure highway preservation needs are fully funded before adding to the current highway system. The rolling program approach ensures emerging needs can be met. Instead of a once-a-decade, 10-year set list of projects, new modernization and expansion projects will be selected for the development pipeline every 2 years. Every region of the state will see modernization and expansion work sooner than later. The bill requires KDOT to develop minimum spending ranges for KDOT districts using a metric-driven process, and 40% of the minimum investment must occur within the first 5 years of the program. T-Works projects must be delivered and are not included in the minimums. Every Kansas county will receive at least $8 million in transportation improvements. Broadband and new technology investments are included to facilitate expansion and prepare Kansas infrastructure for improved safety and communication. I want to commend my Transportation Secretary, Julie Lorenz, as well as the bipartisan work of our legislators, especially Senate Ways and Means Chair Carolyn McGinn, for the overwhelming support and work on this legislation. Its swift passage is important to help the Kansas economy recover when this public health pandemic passes. Secondly, the Paycheck Protection Program, a new $350 billion program included in the emergency relief package passed by Congress last week, formally launched today through the Small Business Administration. The program offers companies and nonprofits with up to 500 workers a low-interest loan to cover up to 2 months of payroll and other expenses. Small Business Administration will forgive the loan if all employees are kept on the payroll for 8 weeks and the money is used for payroll, rent, mortgage, interest, or utilities. This program will help Kansas small businesses to keep their workers on the payroll and will be available through June 30th, 2020. I know Kansas small business owners are doing everything they can to hold on to their employees and keep their businesses afloat until we get through the worst of this crisis. The Paycheck Protection Program will serve as a lifeline for the next several weeks as we hopefully get our economy up and running again. That said, it's very important to understand that the Small Business Administration lenders across the nation are bracing for an onslaught of applications now that the program is officially live. The Kansas banking industry is working incredibly hard to assist businesses across Kansas in need of this financial relief. Unfortunately, Kansas banks only received the final rules and guidance relating to the Paycheck Protection Program from the federal government late last night. While there are some Kansas banks that regularly work with SBA lending programs that will be able to begin the process of accepting applications for the program today, it will take some time for most Kansas banks to review and implement the guidance. So although I encourage qualifying small businesses to apply for the Paycheck Protection Program, please be patient with your local lender as they work through these federal rules and regulations as quickly as possible. Our bankers are doing everything they can to serve their customers, but it's going to take some time to process the applications. Thirdly, this week we also launched a new jobs website through the Kansas Department of Commerce, connecting job seekers with Kansas businesses hiring to fill urgent needs during the COVID-19 pandemic. The COVID-19 job site, kansasworks.com/coronavirus, allows employers from essential industries to quickly and easily post critical positions that need to be filled to support activities related to helping individuals and businesses during the crisis. The site, which is available at no cost to employers or job seekers, will be updated continuously as businesses and add new jobs to the system. Job seekers can visit the site to find companies hiring for COVID-19 related positions and quickly access company hiring portals. Again, to access the COVID jobs website, visit kansasworks.com/coronavirus. Finally, we're joined here today by President and CEO of Blue Cross Blue Shield of Kansas, Matt All, to announce that Blue Cross Blue Shield will waive cost sharing for treatment of COVID-19 for the next 60 days. This includes coverage for testing and treatment administered at a doctor's office, an urgent care facility, an emergency room, as well as inpatient hospital stays. This announcement applies to fully insured members along with those who receive their insurance through Medicare Advantage plans. Blue Cross will also work with self-funded customers who want to implement a similar approach so that these members' needs can also be met during this time of concern. Blue Cross and Blue Shield has already expanded coverage to help members by waiving member cost sharing, including co-pays and deductibles until May 15th. For medically necessary diagnostic tests related to COVID-19 and the cost of the visit to a doctor's office, urgent care, telehealth, and emergency room used for diagnostic testing of COVID-19. Related services like flu tests and respiratory tests provided during urgent care, emergency room, or in-person or telehealth provided visits that result in an order for or administration of a covered diagnostic test for COVID-19. Telehealth services for any visit that is medically reasonable to be done using this technology. The visit does not have to be specific to the COVID-19 testing. Blue Cross will also allow members to refill prescription medications before they are due to be refilled. I applaud Blue Cross for taking this action. Thousands of Kansans rely upon Blue Cross for their health insurance, and I want to thank Matt All and his team for his leadership, especially in these financially and emotionally difficult times. This is the definition of what it means to be a Kansan. Matt is here to answer any additional questions you may have after the press conference. And with that, I will hand it over to the Secretary of Health and Environment, Dr. Lee Norman.
Thank you, Governor. Let's start off with today's numbers in terms of case counts. We today have 620 positive coronavirus cases in the state of Kansas. That represents 138 new cases over the past 2 days. And we've talked in the past about what we expect the rate of growth to be, and until it levels off and turns a corner and starts coming down, and that's right on the upward slope of the Nike swoosh, just like we have talked about in the past. So it's unfortunately as we predicted, but optimistic that we will be reaching the peak of that in the not too distant future. We now do about only 20% of the testing in our Kansas Health and Environment Laboratory, and the other 80% are done by commercial labs. I still report that 6,454 negatives. By far and away, most of the testing we do is still our negative tests. We've had 17 deaths to date in the state of Kansas. And again, some people I know have started doing the math and saying, well, that's 17 out of 620 positives and how many negatives there are. We have to remember there's a lot of testing that's being done out there that don't come into our numbers. We only, in our agency, only hear about positive tests because that's a reportable disease. To testing, we have struggled, as you know, to get the materials we need. We have the Cefiad, the new test, which is a rapid test, has arrived. We have test kits for roughly 900 right now. It's a 45-minute test. You know that we've had been 4 to 6 hours turnaround, so much more rapid, which will ultimately help us to do more population testing and not just testing to ill people. We'll get a lot more of those test kits coming in. As you can imagine, it was only approved by the FDA on 21st of March, so there's a terrific demand nationwide, worldwide, really. But I think we are going to have a supply probably very soon to do what we want to do, which is really to take this to the next echelon, which is population testing. We have a second platform that we've added, the Perkins-Elmer test. It's actually essentially what we've been doing, but we've added a fourth platform on for the same one, which will allow us to escalate to 700 to 1,000 tests per day with that particular platform. Really good news that will allow us to set up testing stations and other advanced ways to screen, so we can really answer the question, what is the real burden of disease out there? It's becoming abundantly clear worldwide as well as in the United States that there's populations, particularly in the 20 to 35-year-olds, that are certainly having the illness and transmitting it, but are not particularly symptomatic. We really want to get a handle so we can do early identification so as to prevent the spread and have earlier isolation and quarantine. As we predicted, unfortunately, there's clusters of cases that have occurred, mostly in residential centers where people have restricted mobility. Memory care units, long-term care facilities in the state. We have in Johnson County, Wyandotte County, and Coffee County, where either the caregivers and or residents have contracted the illness. And so we're having to be very careful. We're working with hospitals, and when patients are discharged from the hospital, what does it take for somebody to be negative by the time they leave the hospital to go back, for example, to a nursing home? We want to make sure that we contain where people are after they've been positive for coronavirus. I actually think we've done a pretty good job once we've identified a person as having the illness. The Lansing Correctional Facility, we continue to monitor. KDHE, we are managing oversight of the contact investigation for offenders and staff. The local health departments are managing the community contacts of the 3 correctional facilities staff members who, of course, live in the community. And I think we put together, an educational video that went to all the correctional facilities, and I think it's been well received. You know, education goes a long ways. Finally, scorecard. I didn't realize it was going to cause such a stir the other day. The scorecard for social distancing. How much are people moving around? And there's a number of different programs. They're available to everybody who goes onto the internet, by the way. It's not something that we invented here in the state of Kansas. The Unicast was the one I quoted last week. There's now one on Google called the Google COVID-19 Community Mobility Report, and I think we found it fascinating to go there. And basically what it says is, either one of them, stay home. The people are still moving around more. It's fascinating. We recognize that we are making improvements, and I think that this is going to lead to when we peak out, which will be sometime in April. The quicker we get to beyond 36% where we are now, which would be about a C- compared to other states, I might add, the quicker we get to 45% and 55% is when we'll make huge incremental improvements in the decreasing the contagion time of the disease. So we cannot let up on social distancing and stay at home. That's my final comment.
Okay. Any questions?
You mentioned receiving the last shipment from the National Stockpile. Can you clarify what we're talking about when we say national stockpile? Is it PPE? Is it also swabs, ventilators? Like, what have we tapped out now? And what might still come?
Okay, I think it's all of the above. It's the whole host of equipment, tests, all of those kinds of things. What was the stockpile was really the supplies and equipment that had come in through Health and Human Services, HHS, at the federal level. That has all now, all that we're going to get. We really got 90% of the Kansas allocation. We're told that we will not get that other 10%. They will send that elsewhere that they think more in need. The requests that we have put in now since mid-March really have gone to FEMA. FEMA will take over this distribution, or they are supposed to be taking over this distribution. As I said yesterday, we have put in 5, I think now 6 requests, and we have yet to receive those shipments. We are hoping that they will come in because we plan to really clear out our inventory by next Tuesday. We will absolutely clear it out. Everything will go down to our local county health officials for distribution to their health facilities. So that's got to get restocked. We do expect that we could get some in from the private companies that we've also ordered from. We've experienced shipping delays with them, or sort of the diversion of orders that we put in either to other states or even to the federal government. So we're hoping, though, that at least some of that will reach Kansas by Tuesday before we're completely out.
Where do you want on masks for folks just walking around?
What do I think about, like, you wearing a mask?
Yeah.
Actually, I don't think that's a bad idea, Martin, but for other reasons, no. No, here's the deal. Right now, it's critical that we get the personal protective equipment to our frontline people, to our first responders, to our healthcare workers. That's where we have to focus our energies right now. The issue of whether the individual citizen, I don't think that the jury's in on that yet. But even if the jury were in, the supplies aren't there. So, right now we need to make sure we're getting them to our hospitals and to our fire departments and other emergency management folks.
I want to follow up on that. See a lot of people wearing homemade masks or some sort of thing. I saw people with toilet paper stuck up their nose the other day in the grocery store. That was a new one. But homemade masks or any sort of homemade preventative measures, where does that, this is for Dr. Norman or Governor Kelly, but what does that really do? Is it actually effective?
Well, I'll let him talk about the efficacy of it. I think the one thing I would caution people is that, when you put something over your face, you're going to be trapping some of your exhalations, and you might be trapping those in that. So if you're going to do that, make sure that you clean it regularly, rather than letting it essentially become a petri dish.
If I may add, well, first, I agree. They get nasty. Let's start with that. Behind there, because of the reason the governor said, they also don't work very well. But we are investigating it. And it's interesting because when you look at South Korea, Hong Kong, Japan, for example, everybody wears a mask, even people who are not ill, just out living freely in the community. It's also quite a social dynamic, is that it encourages people to distance, because you're less likely to get up close to somebody that's wearing a mask. It's just part of a basic belief set, which is that person is best avoided. And it's thought that it actually probably improves the social distancing as much as it, because we know that and I won't go into how graphic sneezing through a cotton mask is, but it's pretty dramatic what it doesn't stop. And that is the things that are infectious.
Do you have any concerns with, we may have seen the op-ed in the New York Times a few days ago about a Yale physician raising concerns that there might be a lot of false negatives with testing that involves the nose swabs because it could be difficult to get the gunk, for lack of a better word, that you need. So what's the issue with negative, false negatives?
Yes, the question is about false negatives, and anytime you do any kind of a test, there's always the risk of false positives and false negatives. I have immense confidence in our testing that we do in our state lab, and the reason is, and I may have commented this a few weeks ago, the flexible swabs that go way back there, and to get the sample also, then when we use them in our laboratory, we test for the human cells. Because if there's not human DNA in there, then it means that it wasn't a deep enough swab. So it's a quality control thing. It's 95+% sensitive. I do have that concern, as did does he, for the self-administered things. People aren't willing to make the swab as uncomfortable as it needs to be, or the oral things. There's different methods that are being experimented with, and if you don't have a quality control mechanism, like I mentioned, with the human cells and human DNA to know that it's a good sample, then the risk is unacceptably high of false negatives. And it's really a concern, because a false negative means that you have somebody that's out in the community that thinks that everything's fine. And that's why, again, as I mentioned, social distancing, even if you have a false negative but you're sick or you might have been exposed, is still important, because then it may lead to retesting and then a true positive.
Secretary Norman, we've heard some people that have been tested that are still, they're having to wait a little bit longer for their results than they've been told that they need to wait. Have you heard about those kind of testing backlogs? Are those occurring in the state?
Yes, the question was why the long backlogs on some testing. I know ours in our laboratory is 1.05 days, so it's just barely over a day from when we get the sample in. I think the commercial labs, they're very high volume and rapid throughput, but they're not necessarily local. Some go to Virginia, some go to California, so there's a transit time to get the turnaround. Very encouraging. Good example is KU Hospital. That now, for the last 8 days, has done their own testing on site. We've assisted them, and they are able to get access now to the reagents. They do the testing twice a day, so they essentially, it's not real time, but it's certainly same day testing. And so the closer you get, testing is done to home, whether in a complex lab like a KU or one of the hospitals, et cetera, or in our own state lab, the quicker the turnaround time is, because you don't have to add in the transit time.
How's the budget holding up? Spending holding up for now? Are we out of administrative leave time, or?
Well, we talked about that yesterday, and I believe today is the last day of that first order for administrative leave. And we actually put out an announcement yesterday, I believe, Wednesday.
Yeah, what about the revenues?
Oh, you want to know about revenues? Okay, so we did get the or the March numbers, and they were pretty much on target, a little low, but nothing unusual. But we know that that's not going to continue. The next time we will hit it will be when we do the consensus revenue estimates in late April. We're delaying income tax returns. That's going to hit our revenue stream quite significantly. Yesterday, we gave a pass to our businesses on any interest and penalties for their quarterly estimated payments, so we won't be seeing those coming in as robustly as they should. So yeah, we're gonna start to see the significant decrease in our revenues in these coming
Have you
months.
started to do anything internally to cut expenditures?
No, actually, if anything, we're spending more because we've got a crisis to deal with. So we are spending the money that the legislature appropriated for the COVID virus. That is going out. We have made no cuts in any other expenditures at this point for a host of reasons. One, because as you know, it's not like there's a lot of fat to cut in our agencies. They were just starting to come back and get restored from the previous 8 years. So there's not much to get there, but it's also because the only way we could reasonably do anything is when we actually have the numbers, and we don't know the numbers yet. we need to wait until the consensus revenue estimates are done, and then we'll see. You know, just knowing what was in the budget, what was in the ending balance, I'm pretty comfortable that we can make it through this fiscal year. You know, and what we'll need to do is to look at the next fiscal year and see if the budget that was passed by the legislature can actually be implemented.
Would we be in better shape now had the legislature passed Medicaid expansion?
Oh, absolutely. You know, if they'd passed it 5 years ago, we'd be really much better off, just because, you know, it would have been bringing in about $1 billion a year. It also would have been incredibly helpful for our healthcare system. You know, we understand that the hospitality industry is taking a big hit, and a number of others, but, you know, what we sometimes forget is that our hospitals now have turned their attention to the COVID virus, and so they've eliminated elective surgeries. You know, they're not doing a lot of routine appointments. So, and that's all revenue for those facilities. That revenue is not there at this point. If we had done Medicaid expansion a long time ago, they would have had better bottom lines and better cushions to ride this through, and then better ongoing revenue.
Have you done it this year? Would there really been any, would we have known it yet?
No, no, we would not have seen it for this fiscal year. Next fiscal year, it would have started to impact us. But I think what we really need to remember, and why it's important if the legislature is able to come back for them to pass Medicaid expansion, is because, you know, the recovery from this, the economic recovery from this, is going to be long and hard. And Medicaid expansion going into effect in 2021 will help us greatly in that area.
What is the status of testing costs for people who are uninsured? Because Congress passed a law to cover COVID-19 testing for the uninsured, but it seems to also involve maybe some legwork by states to route it through the Medicaid program.
Yeah, they will allow us to then use Medicaid dollars to cover testing and treatment for anything COVID related, for people who are not covered by Medicaid at this point, who are uninsured.
So if someone goes now and doesn't have insurance, will they get a bill, I guess is what I'm trying to figure out. If I go tomorrow and I don't have insurance.
Well, if, you know, tomorrow you might, because we probably don't have the system set up yet, but the stimulus bill from the feds will allow us to use Medicaid to pay for your COVID testing or treatment.
Governor, the KU Chancellor predicted yesterday that KU will lose tens of millions of dollars over the course of the pandemic. What state relief options will be available to help offset some of those losses for higher education institutions across the state?
Well, a couple of things. You know, one of the things I told the regents, you know, even before the end of the legislature, when this was just starting to kick off and they were, you know, keeping kids off campus and whatnot, I said at that point, please itemize all the expenses that you're incurring due to this. You know, if they're having to refund room and board for students, or tuition, or whatever it might be, to keep a laundry list of those expenses so that when we know what's in the stimulus package, you know, we might be able to use some of that to reimburse them for those things. But even more, that'll help me figure out what to ask our congressional delegation to push for in stimulus 4, because I'm absolutely sure that there will need to be a stimulus 4, and I think higher education ought to be a serious consideration in that package. Last time I was on a call with the National Government Association, all the other governors, that issue about higher education taking such a big hit is obviously nationwide. So it's something we have to address.
Maybe to the dismay of a grab-and-go crowd, but talk about why it's kind of important to stop self-serve food items, to stop the sales of those.
Would you like me to take that?
Go ahead.
Because people can spread through touch. And some of the grab-and-go, or I'm thinking of like a bin of green beans at a grocery store or something. You see people reach in with their bare hands. Really bad idea. Because these are the things that carry as well as coughing and droplets and that kind of thing. They're here. Some of them have put up gloves that you can use, and tongs. It's probably a safe way to do it, but people are notorious for not necessarily following good infection control principles when they pick up food.
Governor, there's a letter going around saying that Homeland Security is preparing to mobilize the National Guard in preparation for a nationwide 2-week quarantine. Is this true?
Yep, there are a lot of rumors out there. That's one of them. The reality in Kansas is that we have activated 72 guardsmen and women, and they are deployed primarily for distribution purposes, logistics purposes. That's it. And I don't see that changing as we move forward. Everything will always be on the table, but right now I think we need those folks to be helping us move equipment, tests, and get other things out to Kansans.
Secretary, I've got a question for you. Numbers right now show the age group of 20 to 44 be the biggest amount of coronavirus cases in Kansas. Why do you think this is? Are younger people getting out more than they're supposed to?
Yes, so 20 to 44-year-olds, why is it the highest age group for the spread of the virus, you're saying, or asking? Yeah, a couple things. One is that group is typically not as likely to be symptomatic, so they feel good or minimally, and kind of go about normal activities, which are a bad thing when we're having stay-at-home orders and really need to be paid attention to. And also, young people are less likely to follow the rules and feel vulnerable. And see, older folks, people with other kinds of immune understand that they are at risk, and young people don't necessarily feel they're at risk. So I think it's both outgoing. I need to concern myself with infecting other people by being out and about, but I'm not invincible to catching it myself. So I think we just need to be more attentive to the stay at home.
Secretary, on that, because I am a young person, so what would you recommend for young people who might be asymptomatic? How are we supposed to know I should be staying home? Or, would you have any advice for them?
Yeah, there is no substitution for just saying I could possibly be carrying the virus and I need to stay at home. The executive orders and as well as common sense apply to everybody equally. And all I can say is you just have to believe that what we're saying has some truth to it, and subordinate one's own personal needs for the greater good.
Yeah, Corinne, if I could also respond to that. I mean, a lot of these 20 to 24-year-olds, most of them have parents, a lot of them have grandparents. And so if they don't do it for themselves, do it for their parents, do it for their grandparents. Stay home, stay healthy, and keep others healthy.
Do we know anything about access to, the term elective care is really squishy, and there's a lot of elective care that's been scaled back right now that, might be very urgent in some ways, like getting a tumor removed. And I know in some places where the outbreak is really bad, it's hard for people to get that care. Are we monitoring in Kansas access to care that's important that isn't COVID-19 care?
The question is about elective care. What is it? And do we monitor it? And we don't monitor. We don't have a scorecard that says this is the number of elective cases that are being done anyway. But I absolutely agree with you. There can be even, for example, cardiac stenting procedures that are not necessarily emergent, or maybe not even urgent. There could be tumors that should be removed. Most of those would go ahead and get operated on because of the fear of the urgency that goes along with the monitoring system in place. People are self-policing that. It's interesting though, and I have made personal calls to people that run, for example, ambulatory surgery centers, because people have reportedly said we're going through protective personal equipment here on elective cases, and that just doesn't seem to me to be right. So we'll call and give feedback that they should not be doing that because of yes, the concern about being with other people in a close environment, but secondly, that's a low priority for the use of PPE.
Secretary, I asked you this on Wednesday, and I'm going to ask again because you didn't really have any answer, and you said you would look into whether or not we can release those locations of people who have died in the state. Have we kind of figured that out?
and I'm working with the governor's office. The questions about releasing the locations of death. I did work on this with my staff and talk about it, and we don't do that with any other disease, number one. And mostly it's because of out of privacy reasons that, especially in smaller counties, we think it's important that people maintain privacy, and that can include up to including the cause of their death. And it's easy to narrow it down in particularly smaller rural counties. At the other side of that, and we're going to follow about this, it also is of interest to people. Where is the spread of this disease? So we've not dismissed this as something that we might consider for the future.
Any comments on a question I had asked last week, I think, on whether they might be able to track how many healthcare workers get sick with COVID-19 in campus?
The question is about the number of healthcare workers. We know there have been healthcare workers infected. We don't know that they've been in the work setting or in their personal lives. We know, for example, one came back from an infected county in Colorado, and the infection occurred during the incubation period following that. We don't have it. I think we can get that eventually through workers' comp type of information. Now we don't manage the workers' comp for most of the places where people are seeing patients, for example. But I think that number is out there if we were to aggregate. We just don't have a information stream that has that right now.
More questions?
For the rapid testing that you said that we're going to slowly but surely coming in, well maybe not slowly, but and you want to do the population study. How quickly round up do you anticipate being able to do stuff like that?
We feel that if we get, the question was how quickly we can stand up population studies. We can do that within a week from the time we turn the switch on. And we can do it with local health departments if they have enough staff to do the sampling, or we can do it through drive-through kiosks, if you will, to test people. And because it only is going to take us a week to crank those up.
Thank you.
I'd just like to remind you that Matt All from Blue Cross Blue Shield is here if you've got any questions for him. Every bill that's come to me, I sure have.
Oh, okay, I didn't know if there were any.
Huh? Yeah, no vetoes.
By the way, I didn't ask for it.
Do you update this little chart you put out of blood every day?
Well, we
Okay,